have been doing wounds for maybe 12 years. I'd have to work numbers to know for sure. Currently, I see wounds in the acute care and outpatient settings. Evidence is support, research support for my choices. There is a lot of emphasis on randomized controlled trials. Personally, I like evidence that is based on real people, real situations. Rather than lab, I like in vivo, which is real-time patient data. The most common type of evidence seems to be very one-dimensional. Sometimes we're looking at a wound. A lot of times what I read doesn't provide me with all the data about the patient. Nutrition, mobility, cognition. Sometimes I don't get all the information about the wound, whether there is viable or non-viable tissue. What I wish I had more of were head-to-head comparison studies on products, rather than this particular product works on this particular wound. I would like more across-the-board comparisons of products. I really am very much, as a practitioner, as a clinician, I need to see what works on patients like my patients. So I'm not going, and I need the information about who the patient is and what their comorbidities are to apply that information to my patients. I'm not as much concerned, be me right or wrong, I'm not that much concerned about RCT randomization. I think a lot of that is overrated, in my opinion, in wound care, because it's very difficult to get an RCT. It's my understanding that currently devices can piggyback on research of other devices. I have a personal issue with that, and I think that if I, as a clinician, am going to choose a device or perhaps an advanced product, I would like to see research related to that particular product as versus research piggybacked on another equal product. In some aspect, we need to start focusing on not just the wound experts, we need to focus on the non-experts to improve quality or to improve healing outcomes, because wound care is not a pill, it's a process. And just like a row of dominoes, if one or two dominoes are out of the process, it fails. Therefore, we need to focus on every domino, be them medical doctors who are not educated as wound specialists, to the RN who's not educated, to the frontline worker. So I believe we need to improve contact with those folks.